There are many different approaches to preventing and treating perinatal depression. Different types of treatments will be recommended depending on whether your symptoms are mild, moderate, or severe. In this video, we will go over some of the types of treatments that have the best evidence for prevention and treatment. Lifestyle interventions that focus on changes in exercise and/or sleep may be useful to prevent and treat mild depression. Getting 2.5 hours of moderate exercise per week has been shown to help prevent and treat mild depression. You should speak with your healthcare provider to discuss what lifestyle interventions might be most helpful and appropriate for you, especially during pregnancy. If you are consistently not sleeping well, you may be more likely to struggle with your mental health. Try minimizing nighttime wakings by involving your partner or another adult in overnight feedings. If you suffer from insomnia, there is very strong support for cognitive behavioral therapy for insomnia. Lifestyle interventions can also play a role in more severe cases in combination with psychotherapy and/or medication. One key risk factor for depression is isolation and the feeling of not getting enough support. Informal interventions like receiving support through your community, family, and friends is incredibly important to preventing depression and can also be really important when you are receiving treatment. Not everyone has good access to informal supports from their family and community. More formal supportive interventions exist too. One example is peer support, where people who have experienced perinatal depression in the past are trained to provide support to people currently going through it. Another example is co-parenting education, where parents are supported to learn skills to navigate the stresses that come with new parenting. A third example is supportive listening visits, with home visitors trained in listening and problem solving. Usually this approach has been tested with a nurse. These interventions can help to prevent perinatal depression and on their own can be treatments for mild depression. They can also help in the treatment of moderate severe depression, but usually only in combination with psychotherapy and/or medication. While these interventions have been shown to be helpful, it is important to note that people with great support networks may still experience depression. Psychological interventions are what many people think of when they talk about therapy or talk therapy. There are many different kinds of talk therapy. Some common types that are known to help in the perinatal period are cognitive behavioral therapy, interpersonal therapy, behavioral activation, and mindfulness-based therapies. Therapy sessions are most effective when attended consistently. Most therapy sessions are usually delivered weekly, last from 4 to 16 sessions, and can be delivered in person or online, individually or in a group. There are also some self-help therapy books and programs that can work. These are more effective when combined with the support of a trained coach, rather than working on them on your own. The goal of treating depression with medications is to significantly reduce or eliminate symptoms, as well as prevent episodes in those who are at high risk of relapse. Most medications used to treat depression are considered compatible with pregnancy and/or lactation. However, it is important for each person to weigh the potential benefits of a medication versus any potential side effects or safety considerations of taking the medication. If you are already taking antidepressant medication, your healthcare provider may encourage you to stay on your medication. This is especially the case if you have suffered severe depression in the past and have a high chance of relapsing. Specific information about the risks and benefits of different medications for depression can be found in the CANMAT guideline or the accompanying patient and family guide. There are other types of treatment for depression that are not used as often as medication or therapy. For example, there is some evidence for bright light therapy treatment for depression in pregnancy and postpartum. It would be important to talk to your doctor about the dosage and how to use this. There are other treatments that might be offered if the previously mentioned treatments haven't worked. In rare cases, when depression is very, very severe, people sometimes require admission to hospital. Finally, many people ask about complementary and alternative treatments for depression, such as yoga, acupuncture, massage, or vitamins and plant extracts. The research on these types of treatments is not as strong as the research for other treatments in this video, so they are not usually recommended as the first treatment to try, nor as treatments on their own. There is some support for certain interventions in preventing and treating mild symptoms of depression, so they may be helpful to consider in addition to other treatments. However, there are also some alternative treatments that look like they don't work very well. And then there are some treatments that are derived from natural compounds, but are not recommended. Please speak with your healthcare provider to discuss what complementary and alternative treatments might be most helpful for you. You should continue to follow up with your healthcare provider until you recover. This is especially important if what you try first is not helping you enough and a different treatment is required. In addition to creating a treatment plan with your doctor, many of the treatments that we went over in this video can be accessed on your own, especially through online communities. If you are thinking of suicide or of hurting yourself or your baby, please seek immediate help. You can call or text the Suicide Crisis Helpline 988 in Canada or the US. You could also dial 911 or go to your nearest emergency department. For more information, visit canmat.org. Here you can download Seeds of Hope, which is a guide to mental health issues in the perinatal period, and access other resources related to the 2024 CanMat Guideline for Perinatal Mood, Anxiety, and Related Disorders, such as community resources, symptom scales for you to fill out, and more videos in this series.